In this video, we'll go over the causes of your shoulder blade pain, how to make it go away, and how to make it never come back again. There's three main reasons for your shoulder blade pain: neurological reasons, muscular reasons, and skeletal/joint reasons. We can address each of these causes with specific exercises to make sure that the shoulder blade pain goes away forever. Neurologically, our shoulder blade area is a referral region for our cervical and thoracic vertebrae if there might be some sort of a neurological issue like a protruding disc, for example. To address a possible bulging disc, we can do a variety of different chin tuck exercises to help alleviate our discomfort.
Chin tucks on our back can help strengthen our neck muscles to improve our forward head posture, which may be contributing towards disc issues in our neck. These chin tucks can be performed 3 sets of 10 with a 5-second hold in between each chin tuck. You can perform this once per day. Chin tucks lying on our stomach can also help improve our forward head posture by strengthening our neck muscles as well. These chin tucks can also be performed 3 sets of 10 with a 5-second hold for each chin tuck, and these chin tucks lying on our stomach can be performed once per day.
A muscular region for your shoulder blade pain could be due to your rhomboid minor, major, or maybe your middle trapezius muscles having a muscular strain due to poor posture or poor lifting techniques. To address a potential muscular strain in this region, we can perform specific stretches and strengthening exercises to help alleviate the discomfort.
For muscle strains, gentle strengthening of the muscles of our shoulder blade like the rhomboids and middle trapezius can help improve our symptoms. To perform these scapular sets, we'll squeeze our shoulder blades together for about 5 seconds and then we'll relax. We'll perform about 3 sets of 10 of these exercises once per day. Myofascial release with a tennis ball or a lacrosse ball can help break up some of the tightness in this region and alleviate some of the pain. Place the tennis ball over the region of discomfort and grab a wall, or you can lay on the floor and gently roll the ball up and down, side to side, or clockwise or counterclockwise for about 3 to 5 minutes total as needed.
To address joint-related stiffness in this region, we can do a variety of different mobility exercises that can help alleviate discomfort and improve mobility in this segment of our vertebrae.
Rotation exercises at the shoulder blade level of our spine can help improve our overall rotation or side bending range of motion capacity. To perform this exercise, kneel on a pillow in front of a couch and place your hand behind your head. Slowly rotate your torso towards one side. So in essence, pointing your elbow towards the ceiling, then rotate back to neutral. This exercise can be performed 10 times on each side once per day. Seated thoracic extension exercises at the shoulder blade level of our spine can improve our overall extension range of motion and help reverse forward head posture from sitting at our desk for long periods of time throughout the day. To perform this exercise, we'll sit in a chair, grab a ball or a large pillow, and place it just below your shoulder blades. Place your hands behind your head and slowly extend through your mid-back and return to neutral. This exercise may be performed 10 times once per day.
Thank you again for watching. If you have any questions about any of these exercises, be sure to leave a comment below. To keep the shoulder blade pain from coming back again, we want to ensure that we avoid specific postures and activities that are causing this pain, and making sure that our modifications with these particular postures ensure that the pain never comes back again.
Slouching on the couch like this with a flexed neck can cause immobility of our mid-back and possibly lead to disc protrusions. To fix this, try to orient yourself on the couch in a straight line between your ear and your shoulder to take stress off the disc in this area that can cause the shoulder blade pain we're experiencing. Strategically use the backrest of your couch or pillows to help achieve this posture and help alleviate that pain. Similar to the couch, we want to avoid a flexed neck posture while sitting in a chair as well, so orient yourself to sit up tall with a straight line between your ear and your shoulder to offload pressure on the spine and improve your pain symptoms in this region.
Now, our shoulder blade region can also be a referred pain source for any sort of organ pathology as well. So if you're doing these exercises and activities for 2-3 weeks and you're doing them diligently and it's not getting any better, it might be a good idea to seek a medical professional. These are some of the organ pathology regions that refer to the shoulder blade: our gallbladder, liver, heart, lungs, and diaphragm. A lot of the time, if we're sitting at our desk for long periods of time, our shoulder can become aggravated and have pain due to poor posture for 8-9 hours. Check out this video above for more solutions to shoulder pain at your desk, and I'll see you over there.